Welcome to this week's Keuchel's Corner. I'm Dr. Keuchel, and I'll be walking through different ways in which we can use heat as part of our rehabilitation process to get you back doing what you love to do. So, last week I talked about ice and its role and how we can use it to mitigate pain and control the inflammation process. Heat is going to be a little bit different in how I utilize it and when the best time to utilize it is. So heat is going to work by improving blood flow to the area that you're trying to get to feel better or get to move a little better. It's going to improve the elasticity of the tissue and specifically reduce some of that muscle stiffness that you have. So whenever you have an injury to any certain area, whether it's a spasm, an old strain, an old sprain, or any kind of like osteoarthritis type condition, your body's going to naturally protect itself by stiffening up and creating that spasm effect, and basically prevent you from moving that area around because that's what's causing you pain. So getting the heat into that area is going to help to reduce that, allow you to move a little bit more free. And the way that it does that is it actually activates some of the thermoreceptors in the area. And those thermoreceptors, just to break it down, they're temperature sensitive nerve endings. And so whenever we put heat on that area and sometimes even put a little bit of pressure with it, it's going to block those pain signals from going to the brain. So what this is going to do is provide a short-term relief to that pain within that area. And opening up that area to allow yourself to be able to move a little bit more freely can allow us to get in to do either manual work within the office, maybe even open up, do some exercise, get you moving a little bit better so we're not having those compensation patterns, or simply just calm down that hot low back you have that's keeping you from getting comfortable at night or allowing you to do your work. So with heat, it's not something that I utilize as much as maybe ice, but it is something that I utilize more with like chronic conditions or to help get the session going. So anytime you have any sort of spasm, low back pain specifically, or just some arthritis or just joint issues that have been lingering for a long time, heat's a great way to get the body to feel a little bit better, calm things down, but just understand that it is a short-term solution, so it's just going to open up that window for us to open up that window for you to do some work in that area. So I just want to pull up this paper as well. It's going over low back pain specifically, but it brings up some good points about other areas of the body and when we can utilize some of this to some of the heat therapy to improve our situation that we're dealing with, whatever it may be. So it goes through and it talks about some of the just basically overview of how it works, and that's where I was talking about the pain receptors, the thermoreceptors, and how we can utilize the heat to actually get those to serve as more of a pain relief method. So once again, just like ice, it's just a way to bring that pain down, control it. There's just certain situations that are going to work a little bit better, such as the spasms, low back pain, and arthritis conditions that I've mentioned before. But it's not limited to just low back pain. It talks here as well about other applications. Some just to be named, just so we can go through, is neck pain, knee pain, wrist, old injuries, carpal tunnel, sprains, strains, anything that's not like super acute other than a spasm, but like old injuries that have just kind of limited your motion. Great way, great resource to use to open up some of that movement, and making sure that we utilize that window that we've opened up to allow us to have a little bit more freedom. So once again, this is just kind of how I would use it, how I recommend that people use it within the office, and then how they use it between visits. This can be a really helpful tool to allow us to move and have a little more comfort and get us to respond a little bit better to care. If you have any questions about anything that I went over, feel free to reach out to me at the email that I provided. I look forward to doing more of these videos in the future. I really hope you enjoy this. Once again, this is how I would use heat and how I would apply it to any patients that come through the office and what I would recommend for them.